Hello and welcome. Today we're diving deep into a rare and often overlooked condition affecting the urinary system, bladder lymphangioma. Join us as we explore its intricacies, from its potential origins to the latest advancements in diagnosis and treatment. The exact cause of bladder lymphangioma remains elusive, making it difficult to pinpoint a specific etiology. However, several theories exist. Some researchers suggest it may be a congenital condition, meaning it's present at birth, stemming from abnormal development of the lymphatic vessels in the bladder wall. Others propose it could be acquired later in life, possibly as a result of chronic inflammation, obstruction of lymphatic drainage, or even trauma to the bladder. More research is needed to fully understand the factors contributing to its development. Bladder lymphangioma is characterized by the abnormal proliferation of lymphatic vessels within the bladder wall. These lymphatic vessels, normally responsible for drained and immune cells, become dilated and form cyst-like structures. This abnormal growth disrupts the normal function of the bladder, potentially leading to inflammation, irritation, and various urinary symptoms. The extent of the lymphatic involvement dictates the severity of the symptoms. Due to its rarity, precise epidemiological data on bladder lymphangioma is scarce. It is considered a rare condition, often diagnosed incidentally during evaluations for other bladder problems. It doesn't appear to have a significant predilection for any specific age group, gender, or ethnicity, making it challenging to predict who might be affected. Better reporting and diagnostic techniques could potentially shed more light on its true prevalence. The symptoms of bladder lymphangioma can vary widely depending on the size and location of the lesion. Some individuals may experience no symptoms at all, while others may suffer from a range of urinary complaints. Common signs and symptoms include hematuria, which is blood in the urine, frequent urination or urinary urgency, dysuria or painful urination, and pelvic pain or discomfort. In some cases, the lymphangioma can cause urinary tract infections. These symptoms can mimic other bladder conditions, making accurate diagnosis crucial. Diagnosing bladder lymphangioma requires a thorough evaluation. A cystoscopy, where a small camera is inserted into the bladder, allows direct visualization of the bladder lining and any abnormalities. Imaging studies, such as CT scans or MRIs, can help define the extent of the lesion and rule out other potential causes. However, the gold standard for diagnosis is a biopsy, where a small tissue sample is taken and examined under a microscope to confirm the presence of dilated lymphatic vessels characteristic of lymphangioma. While bladder lymphangimas don't have a strict classification system, they can be broadly categorized based on and location within the bladder wall. Some may be localized, involving only a small area, while others can be more diffuse, affecting a larger portion of the bladder. They can also be described based on the depth of involvement, from superficial to deep within the bladder muscle. Treatment for bladder lymphangioma depends on the severity of symptoms and the extent of the lesion. In asymptomatic cases, observation may be sufficient. For symptomatics, treatment options include transurethral resection, where the abnormal tissue is surgically removed through the urethra. Laser therapy can also be used to ablate the lymphangioma. In rare cases of extensive disease, partial cystectomy or removal of a portion of the bladder may be necessary. Medications may be prescribed to manage symptoms such as pain or urinary urgency. Unfortunately, due to the unclear etiology of bladder lymphangioma, there are no specific preventative measures currently known. Maintaining good urinary health through adequate hydration, prompt treatment of urinary tract infections, and avoiding bladder irritants may be beneficial, but these are general recommendations rather than targeted prevention strategies. More research into the underlying causes is needed to develop effective preventative approaches. The prognosis for bladder lymphangioma is generally good, especially with timely diagnosis and appropriate treatment. Most patients experience significant symptom relief following treatment. Recurrence is possible, so regular follow-up with a urologist is essential. Recent research is focusing on identifying genetic markers and molecular pathways involved in lymphangioma development, which could lead to more targeted therapies in the future. Additionally, advancements in minimally invasive surgical techniques are improving outcomes and reducing recovery times.